Good morning. Today we're going to talk about low back pain. Probably one of the most common things that people come to my office complaining of. And there are basically 5 presentations of back pain that people come and describe to me. The first is they'll tell me, I have back pain that goes across my entire low back. Sometimes they say it's only on my right or only on my left side. At other times, they'll say, I have low back pain on my right side that goes down my right leg. Then they may come in and say, another person may say, I have back pain that goes down both my legs. And finally, I have a patient who will come in and say, I have no back pain, but unfortunately I have pain down my leg. Each of those has a significance, and it's too much to go into here, but we can give you some basics that'll help you understand your symptoms and your presentation. So, what causes back pain? Well, a lot of times nothing. Patients will simply come in and say, I woke up, I felt stiff, it worsened as the day went on, and here I am. And they'll describe one of those presentations that I described earlier. A second cause can be people who say, I bent and I stooped and I twisted and I lifted. The body likes to move in uniplanar fashion. So it moves forward, it moves backward, it rotates, or it laterally bends. The problem becomes when we do things that mixes those. So we bend, we stoop, we twist, and then we lift a compressor to put it on the back of our pickup truck bed, and all of a sudden we feel this pain. Well, briefly, that's because we've now torn some disc, we've pulled ligaments, and we've stretched, torn muscle. So those are some of the causes. Other causes can be trauma. In a car accident, for example, the force of the impact causes what we call submarining. It's what causes the body to go down and under the seatbelt harness. And then the body then comes up again, and this changes the shape of the spine for just very brief periods of time, but it can be quite traumatic. Obviously, sports activities can also cause that, but aging is also a process. Aging is typically where somebody will come in and they say, I have this back pain, and I just woke up with it, and I feel so stiff every morning when I get out of bed, but it feels better as I move. And these are all clues as to what the cause is, and in future videos we'll talk about that in greater detail. But what do we do about it? So the patient comes to me, and after a consultation and examination, we decide, well, let's treat this. Let's treat it first. In the first 24 to 48 hours, those are what I call rest hours. They're acute, they're inflammatory, and we want the person just to rest. After 48 to 72 hours, the body needs to move, because if you don't move, that spine will lock down and own you. So one of the things that we do is we start with what we call lumbar stabilization exercises, and we start to just take that spine and start to move it up and move it down and start to just give it some of its normal motion back to it. Then we'll also perhaps perform chiropractic manipulation, or if the spine is too fixed or locked, if you will, we may only do mobilization, which means we take as much motion from the spine as it will give us, but we won't exceed that amount of motion. We may use physical therapy modalities like ultrasound or muscle stim, and we may do some myofascial release. Myo means muscle, fascia means face, so we'll do the face of the muscle and stretch the muscle and the fascia around it. So we'll do some of these things, and maybe we'll prescribe a low back brace if there's instability, or if the person is so immobile that they can't move without significant assistance. And we will possibly prescribe some kind of natural anti-inflammatory targeted supplement called turmeric, which then works on the inflammatory process from within, while we perform the physical medicine to the outer structures of the body. So this is a brief introduction to low back pain, its causes and its treatment. We hope it's been helpful. If this sounds a bit like you, give us a call and we'll be happy to see you and take a look and talk with you further.